today's COVID conversations, we're fortunate enough to be joined by Dr. Adrian Enthoven. Dr. Enthoven will be speaking to us a little bit more around the Solidarity Fund that has been introduced as a response to COVID-19. By way of background, Dr. Enthoven is the Executive Chairman of the Yellowwoods Investment Group, and he serves on numerous boards, including the boards of Hollard, where he's the Chairman, Clientele, Lombard, and Spear, as well as on the boards of Citizens South Africa, the African Leadership Initiative, Business Leadership South Africa, and importantly for this conversation, Dr. Enthoven is also the Deputy Chairperson of the Solidarity Fund. Dr. Enthoven, thank you so much for joining us today.
Thanks, Dino.
Maybe to start, we've all heard a little bit around the Solidarity Fund as was announced by President Ramaphosa a couple of months ago. Can you start off by giving us just a little bit of background as to the purpose for which the fund was introduced?
Yeah, sure. So the idea of the fund was to create like a single kind of consolidated effort for the national response to the COVID-19 pandemic, and to try to unite South Africa behind one effort and one initiative to create one funnel for kind of resourcing that would both respond to the health crisis as well as the humanitarian crisis that's resulted from that. So that was the idea, was to kind of create a fund that's for all of South Africa, that will benefit all South Africans, that will be able to unite all South Africans behind a kind of common effort.
And what are the objectives of the fund in terms of the application of the money you raise?
So there are three key focus areas of the fund. The first and the one that absorbs the most amount of time and resources is supporting the national health response. So the Solidarity Fund works very closely. I mean, firstly, I think it's important to note that the Solidarity Fund is an independent organization. It works very closely with government and business, but it's not a part of government. It's not a business fund. It's an independent, not-for-profit organization that, as I mentioned earlier, is receives money by South Africans and is for South Africans. But we work very closely with Business for South Africa and the health professionals that are working there and the National Department of Health to determine where are the greatest priorities in relation to the health system, where are the greatest needs, where are the crises being faced. So we've kind of plugged into the heart of the kind of planning and thinking about how to deal with the health crisis. And we are like a highly agile, rapid response vehicle that can respond very quickly to particular needs in the health system. And we've been going for 6 weeks now. Within the first week, we had approved of our existence, we had approved 100 million rand facility for protective equipment. Because when we started, the biggest crisis in our health system was protective equipment for frontline health workers. They were just woefully, our system was woefully unprepared. We were sending our kind of soldiers into war here, and they had no armor. They were not protected. And so, within 5 days, we'd approved 100 million rand facility for protective equipment. A few days after that, we increased the facility to 300 million rand, then to 670, and we're now spending. We now have approved facilities, and we'll have orders against those facilities of up to 1 billion rand. By early next week, we would have approved orders against that 1 billion rand facility. A big part of that is for government healthcare workers, but we also have approved a facility for protective equipment for the 30,000 frontline healthcare workers that are going to be doing the mass testing, and also 120 million rand facility for healthcare workers that are operating outside the state system and NGOs that are supporting, playing a critical kind of frontline support role to the health services. So the health response is a major focus of the fund. The other thing that we've done is given a 250 million rand grant to the National Health Laboratory Services, which has enabled them to double their testing capacity. So obviously mass testing is another critical issue. And so we've enabled that. We've procured 200 ventilators, and we have also recently invested in the prototypes for non-invasive ventilators to enable the manufacture of 10,000, locally manufactured 10,000 non-invasive ventilators that we can't buy anywhere else in the world now. So I think we've played an absolutely kind of critical role in helping to get our health services and our health system ready for the crisis that will soon be upon us. The second area of focus of the fund is on humanitarian relief efforts. So one of our core mandates is to support those who are affected by the pandemic. And the two areas that we focused on there, the bulk of our focus to date has been on the issue of hunger and food insecurity. We launched 2 weeks ago by far and away the single largest food relief intervention in the country to provide food parcels to 250,000 families across all 9 provinces, communities across the country. And by early next week, we would have completed that initiative and the delivery of those food parcels. We worked with some of the really big food NGOs. We worked with over 400 community-based organizations, with the Department of Social Development, with the list of ultra-vulnerable families that they had. So it's been a monumental effort, but that is kind of in the humanitarian space. And the other humanitarian issue that we're starting to focus on now is the issue of gender-based violence. I mean, obviously, the issue of food insecurity is an issue which is like much too big for the fund. This is an issue that requires a government response. But what we were able to do was to get in, being this kind of agile, rapid response vehicle, we were able to get in and initiate this kind of very significant program very quickly, while government was kind of lining up their big guns, which is, government's going to be spending 7 or 8 billion rand a month, pumping, cash grants into communities across the country to help deal with this issue. But I think we played like a critical role at a critical time. So that's the second area, is the kind of humanitarian area. And the third is in the Solidarity Campaign. And the Solidarity Campaign is a national communication campaign, and it's designed to inspire and mobilize the country, mobilize resources across the country to deal with the pandemic. So it's about individual behavioral change around hygiene and staying at home in the lockdown and so on, to mobilizing communities to respond to crises. It's about volunteering. It's about getting businesses to think about how they can do more and how they can impact using the resources that they have available. We've had the most phenomenal response from businesses, who've really kind of stepped up to contribute over this time. Part of that campaign is we've launched a national radio campaign in all 11 official languages, and a 12th language, interestingly, which is a Poo language, which is a San language that is has a radio station in the Northern Cape, and we even in that language. So we have a 10-minute insert every day for the next 6 weeks. And that's really about trying to demystify the virus for people, getting them to understand it, what it's about, what must they do when they get sick. So there's a lot of anxiety that's caused by just the unknown around this. And that's also led to other things like reluctance to be tested and so on. So the campaign is also about just helping to calm people by giving them information, empowering them with information about what's going on. So those are the 3 areas that we're spending our money on. And just, I think the final thing to say in relation to the spend is that, we have around 80 people working full-time in the fund now. We've got 15 companies that are providing us with pro bono services. We haven't spent a single cent in the last 6 weeks on anything but direct impact. Every single expense in the company has been pro bono. Even the banks are not charging us bank charges on our accounts. So, we've had the most incredible support. And I think what we've created is like a very efficient, frictionless vehicle to translate the donations we receive into kind of significant immediate impact.
How challenging has it been to acquire, for example, PPE? I mean, you've got almost the entire world chasing ventilators and similar equipment. Has that proven a challenge so far?
Yeah, it's been hugely challenging. You've got, as you say, 190 countries all trying to buy the same packages of goods. It's absolutely a kind of supplier's market. The supply mainly is coming out of China, and you've got hundreds of thousands of companies and individuals and intermediaries and governments all trying to buy the same stuff. And so, what's happened is that obviously there's a lot of price volatility now in the market around some of these key items, because it depends on when big packages come onto the market. Prices vary a lot depending on, literally daily. So we've had to contend with that. We've tried to make sure that, obviously the prices that we've been paying are significantly above pre-COVID prices, but we try to make sure that we're paying within the range of how market prices, have moved. And obviously this is why we've been able to, make such a significant impact. This is a very difficult environment for a government like our government to be procuring into. So decisions that we can make in a matter of hours can take weeks, for governments to make these decisions. And we've been working very closely with Business for South Africa, who've created an incredible procurement infrastructure of private sector people with experience across the health sector, procurement, supply chain and logistics. So that has enabled, this R1 billion of procurement to happen, over the last 6 weeks. But it's a very difficult environment. The other thing is that freight costs have gone absolutely through the roof, because you can imagine there's no normal, freight happening globally. The time constraints have meant that we haven't been able to ship most of the stuff. We've had to fly stuff in. We've had to charter airplanes to bring protective equipment into the country. But it's been a very, very tough environment. And I mean, essentially, we've been buying where we can. So any supplier who's got the right goods available. But also remember, there's a lot of defective equipment out there that people are trying to offload. There are a lot of scams. So, how you manage through that with the urgency of knowing that we don't have a choice not to get this stuff here. We have to get it here. We have to make sure it's from reliable, reputable suppliers. We need to get it here quickly. So it's been hugely challenging. And, the team have done a phenomenal job in getting these orders away. And, we've already landed 100 million, of the R1 billion of equipment has been landed and distributed.
Fantastic. Maybe moving to the future, Dr. Enthoven, first of all, in relation to the Solidarity Fund, clearly an incredible initiative that's been well supported and that's beginning to make a real difference in South Africa. Do you see the fund as potentially being something that may endure as an NGO in the country beyond COVID?
I mean, firstly, just to talk about the support, I mean, we've had incredible support, not just we've had over 1,000 corporates and foundations donate to us. We've had over 175,000 individuals donating to us, anything 5 Rand, 10 Rand, 100 Rand. And that's really important for us because we're trying to build a broad base of support for this fund. It's not just about how much money we raise, but also about getting South Africans behind this initiative and making people feel like they can be part of the solution. We've also received donations from political parties, payroll giving. We received a donation of 6 million Rand on Friday from the EFF. We've received donations from the DA. Obviously, the president has committed to a salary sacrifice that will come to the fund. So we've really managed to appeal to South Africans across, the entire spectrum, which has been phenomenal. At this stage, our intervention is seen as a crisis intervention for this moment. I think the funding that we're receiving is intended to help address the crisis, the immediate crisis that we face. So we don't currently foresee us saving money for kind of post the crisis. We're not in the business of like trying to create a permanent institution. This is an intervention that's intended for this crisis and to address this crisis. If coming out of this, there's a necessity to restructure this into something else, I think we'll kind of cross that bridge when we get to it. For now, we're just focused on, the coming days and weeks and months and, trying to make sure we have the biggest impact that we can possibly have on ameliorating and relieving the crisis.
And Dr. Enthoven, maybe to get your perspective, we've obviously come out of level 5 lockdown, we're now in level 4. The economy is slowly opening and, in turn, we're seeing the number of cases locally increase, which I suppose is to be expected. Maybe just looking to the future, if we as South Africa are to come out of COVID positively, what are the things that we as a country need to do perhaps better than other countries have done abroad in order for that outcome to become a reality?
So I think, the big challenge here is, and I think we're starting to see it, our economy can't really afford a sustained period of contraction in the way that a lot of European and Asian countries, the approach that they followed. We just don't have the resources to help carry households and businesses through a crisis like this. And so, the view of business is very much that we need to start to move through these lockdown process and start to reopen the economy. And this is a matter of urgency, that we're at significant risk of losing, productive, large, parts of our economy that don't come back on stream, when you reopen the economy. So the question is how you do that in a safe way. Obviously, the nightmare scenario is you open up too rapidly, you're not prepared for the opening, you have a massive kind of increase in infections that are uncontrolled, and you have to go back into like a Schedule 5 lockdown. That's something that we need to avoid. So, the big issues that business and government are facing are discussing now. And by the way, there's been phenomenal kind of working relationship, really constructive working relationship between government and business, through this process. But the issue is, how do we manage things like workplace safety? How do we manage testing and contact tracing to make sure that where people are infected, they can be isolated? How do we create thousands of isolation center beds where people who can't self-isolate in their communities have got somewhere to go to isolate while they're still infectious? How do we deal with public transport, which is a major vector for the infection? And how do we make that as safe as we can? So, these are some of the challenges that we face as we reopen the economy. But there's a lot of focus in government and our business to say, let's make sure that we've got solutions to these problems so that we can reopen the economy as quickly as possible.
And maybe just to close off, if I want to invest or donate to the Solidarity Fund, how would I go about doing that?
So that's very easy, Dino, and we'd really love as many people as possible to contribute, even if it's a small amount of money. As I said earlier, like the greater the number of people contributing, the better for us, and is a key metric for us. So the website to go to, where has all the payment platforms on it, is solidarityfund.co.za. And if you go into the website, you can get all the information about our donations. We try and be completely transparent about where we get our money from and where our money is being spent and how it's being applied. But on solidarityfund.co.za, you'll find all the payment platforms that will enable you to make donations.
Dr. Enthoven, it's a real privilege to have had a bit of your time to chat this morning, and an unbelievable initiative, the Solidarity Fund, that clearly is starting to make an impact locally. That's Dr. Adrian Enthoven, the Deputy Chairperson of the Solidarity Fund. If you want to donate, go to www.solidarityfund.co.za. No amount too small or too large will be turned down. Dr. Enthoven, thank you so much for the time.
Thanks very much, Dino.